Thank you all for coming to the afternoon session for Adelante, Adapting Research Goals to the Latino Community Realities. My name is Sean Cleary. I am the Director of the Research Core for the Avance Center, also the Principal Investigator of the Adelante Intervention Project, as well as an Associate Professor here at the Milken Institute School of Public Health in the Department of Epidemiology and Biostatistics. I'm going to first introduce my colleagues on the panel and thank them all for agreeing to share this time with me. And then I'll give a brief agenda of the session. So on the far end is Luisa Montero Diaz, who is the Executive Director of Maryland Multicultural Youth Center. Next to her is Rosa Delme Avellero, who is the Adelante Project Director at MMYC. And next to me is Angela Gonzalez, who is the Adelante Prevention and Community Organizer at MMYC as well. So the goal of this session is to share our collective experience of adapting our research goals to align with the needs and the goals of the Latino community that we serve. This is important because we want to ensure that the activities we're implementing as part of the multi-level Adelante intervention, which we'll describe, are culturally and linguistically appropriate, practical, and serve to enhance the development and well-being of everyone in the community. So with that, I'm going to turn this over to Luisa to give some background on the center. LAYC, I'm sorry.
Is that good? Maybe I'll stand so that I can see you all from back there. So I'm going to just add my welcome to you all to this session. I'm really thrilled to be a part of it and to be sitting here with these esteemed colleagues. As Sean said, today's presentation is really about the interface between research and intervention or programming, which is, while it's being done here and there, it really is still a unique situation when you have, program people and intervention people and therapists and instructors and case managers sitting down with researchers who, this is two world views in a sense. And so what we're going to present today is about how those two worlds can come together. And so you have, Dr. Cleary, Sean representing the research piece of it, and then Angela and Delme representing the program piece of it. And as the intervention partner, Latin American Youth Center, Maryland Multicultural Youth Center has really been proud and lucky to be part of this program and this intervention. So you're going to hear a bit today about that interface from sort of both worlds and how it all comes together. But I was asked just first of all to provide a little bit of context, and this is going to be quite short, but just a little bit of context on who we are, who Latin American Youth Center, Maryland Multicultural Youth Center, MMYC is, and kind of how we came to be a partner in this research. So you'll see here, actually, these are some of our older pictures. We're an organization that's been around for a long time. We were founded in 1968 in the neighborhoods here in the district of Mount Pleasant and Columbia Heights. It was started really, just as many nonprofit organizations are started, because there was a need and a group of people, volunteers in those days, that really said, we're going to meet this need. At that point in time, the late 60s, early 70s, there was beginning to be a flow of Central Americans in particular to this region, and not any services. I hazard a guess to say that in those days there was nothing available specifically for Latino youth and their families. And so a group of people, dedicated people, put together a program in a basement of a church, and that's where it began. So it originally was founded and it served Latino youth and their families, and addressed, as I mentioned, this cultural void that was in the district at the time. Today, so this is like, fast forward about 45 years later, 45, 50 years almost, we're a regional network of youth centers and school-based. We've got charter schools here in the district that were founded by LAYC, and are also not only in the District of Columbia, but also in the suburbs of Maryland and Prince George's and Montgomery County. We now not only serve Latino, the Adelante program is specifically for Latino youth in the Langley Park community, but LAYC, MMYC serves all kinds of youth. And so you can see there's some of the breakdown of the youth that we do serve. And I might add that our staff are I got some recent statistics on the staff. Our staff are about 70% of our staff, and this is across all of our sites, are bilingual. 55% of our staff are Latinos, 35% were born outside the U.S., and this is my favorite statistic, 20 to 25% of our staff were once youth in our program. So there's really a career pathway at LAYC, MMYC for young people who benefit in some fashion from the services that they receive that then come back and want to work in the same communities that they grew up in. And we really consider that one of our strongest assets. So just to segue into the actual intervention, wanted to say that 10 years ago we expanded into Maryland, and we expanded into Maryland for many of the reasons that families and youth were moving into Maryland, looking for affordable housing, looking for just a place to raise families. Also, what was happening in those counties is that was a dearth of services, particularly in the Langley Park area at that time. So LAYC decided to expand into Maryland 10 years ago. Now we know with some of the recent studies that have been done on the suburbanization of poverty that suburban poverty looks different than urban poverty. And so what happened is that we adapted our programs. What worked in DC doesn't necessarily work in the suburbs of Langley Park or Silver Spring or Riverdale or Germantown. So those practices have been adapted, and one of those adaptations is this Adelante program. So I'm going to turn it over first, I think, to Sean, who's going to go over some of the research piece, and then Angela and Delmy will talk about the intervention, and then there'll be some times for question and discussion at the end.
So can you hear me in the back all right? Okay. All right, so I'm just going to give a brief overview of the Adelante intervention just so everyone understands the context of what Angela and Delmy will talk about. So in 2012, we received funding called a P20 Exploratory and Developmental Grant to establish the Avance Center from the National Institutes of Minority Health and Health Disparities, part of NIH. And so as a mission of the Avance Center, we're focused on understanding and addressing disparities among Latino and other immigrant and refugee populations. And the Adelante intervention that we're going to focus on today is one of a couple of studies that are funded through the center right now. So I wanted to give you a little background on the community that we primarily implement the intervention. It's Langley Park, Maryland. It is in Prince George's County, right over the border from DC. Borders Montgomery County to the south, east of Montgomery County, and has parts of Montgomery County in it as well. So the colored area here on the map is actually our catchment area, which crosses county borders. According to the latest census, there are approximately 21,000 people living in Langley Park. Langley Park itself is interesting. It has a name, but it has no zip codes. So it's kind of an unusual geopolitical area. It's part of Adelante and Hyattsville. As you can see from the statistics, 80% of the population is Latino origin. There's in the past decade, 2000 and 2010, there's a tremendous increase in the number of people who moved to Langley Park. And in the past 2 years, we've also seen a large increase in the number of people who moved to Langley Park, although the numbers are unclear in terms of the population. As you can see also from the demographic data, median incomes are low relative to the rest of the country. Unemployment is higher than the national average, and the poverty levels are twice that. So it's a pretty resource-poor area. And we have been collaborating with MMYC actually since 2005 in Langley Park, and have seen some growth, but still struggling in terms of the resources that are available to the community. So the Adelante intervention itself uses a positive youth development framework. Positive youth development focuses on assets of the individual and developing those assets, as opposed to other youth developmental theories that focus on deficits. It's defined by the 5 C's: competence, confidence, connection, character, and caring. And we focus on those, the first 3 at least. And then building those assets leads to thriving. So that's the 6th C, which we call contribution. And each of these assets can be addressed across multiple domains. So we're focused on development in the youth, but that will influence their interaction with their family members, their peers, the school, and others in the community. And that's the emphasis here, to focus on the relationship between people and their community to improve prevention measures. So the goal of the intervention then is, the goal is to develop a community-based intervention focusing on promoting family and community engagement for the prevention of three major risky outcomes, but risky sexual behavior, violence, and substance use among Latino youth. So this graphic shows basically the intervention. I just want to walk from left to right. What we're providing is in the left-hand column, these are what we call our activities or components. And you can see the multi-level nature of the intervention because we have certain components that are focused on the youth, such as the Youth Leadership and Advocacy Program, the Academic Support Program and Job Readiness. We have activities that are focused for the parents, such as the Parents as Leaders Program, and then we have family dinners or multi-family dinners that address everyone in the family. Okay? The corner mark of the intervention is also our case management program. All right? And Delmy will be talking a little bit about that a little bit, and Angela will elaborate more on our activities as well after I speak. So what I want to point out with this graphic is that each of these activities, though, has these positive youth development characteristics embedded in the activity. So when we're planning an activity, we're very aware of the competence, confidence, connection, and contribution, and how we can integrate that into the activity. So that ultimately, when we measure it through post-tests or completed surveys, our goal is to see an improvement in each of these areas. And then we measure it across multiple domains. So we again, focus on competence of an individual themselves, but related to their parents as well, or family as well, and connection with their family as well, and related to the school as well. So it crosses domains. And as this graphic also shows you, ultimately our more distal outcomes are related to behavioral change. So briefly, we have short-term and long-term goals. The short-term goal is to engage approximately 240 dyads. So when we enroll someone into the cohort, we have a youth and a parent or guardian. Okay, and the requirement is that we have a parent or guardian that is also willing to participate in the intervention. And then we're also focusing on positioning Adelante as a brand in the community. Intermediate goals include successful transition from 8th to 9th and 9th to 10th grade. The reason for that is that we see the largest dropout, close to 50% of the Latino youth drop out in 9th grade in this community. And so we're trying to help with that transition. You can see we're focused on building resilience and coping skills for the youth, and then knowledge of these prevention topics for the youth and their parents. So given a large proportion of the population in Langley Park is immigrated to Langley Park, we're not born in the United States, our long-term outcome is that they have the ability to navigate a multicultural environment. We're talking about adolescents here. Many of you have, well, we've all been adolescents, but many of you have adolescent children. You know communication is always an issue. And so one of the things that we do focus on, particularly with the issue related to reunification, where kids are being rejoined with families that they may have not seen for a while, is on parent-child communication skills and connection to the family. And again, because oftentimes, or many times it may be a new family. And finally, overall, again, a community-wide reduction in these high-risk behaviors, as well as greater well-being in the community. So I'm going to turn this over to Angela now, and she's going to discuss more details about the Adelante programs and activities.
Oh, well, hi, how are you? Thanks for coming to our session. My name is Angela Gonzalez, and I am the Prevention Community Coordinator of Adelante. And my role in this project is to support with project management and operations. I also represent Adelante in community meetings, and I've also implemented some sports recreation programs for youth and some parent activities as well. And as Sean said, I'm gonna go over our different programs and activities. First, let me take a moment to tell you a little bit who Adelante is. And on the MMYC side, we are 17 members. We have Delmy here, myself, and over there in the back, we have our 5 case managers. And we all have diverse academic backgrounds. Some of us have an international development background. Some of us have a mental health and psychology background, substance abuse and media. And we also have a couple of team members that grew up in Langley Park and actually went to the same schools that a lot of our youth go to. And so it's really great to have that resource, all that knowledge that they already have. And then I also wanted to take a moment to talk about our participants. You know, Sean went over the demographics and the statistics, but we have a daily interaction with these youth and families. And you know, a lot of them have a lot of things in common. Most of them come from Mexico and Central America. A lot of them share the same immigration experience. Some of them even come from the same villages. But they also have very diverse realities, too. We have youth who grew up in the US and are very assimilated to American culture. We have youth who just got here and don't speak English at all. We even have youth who don't speak English at all, just speak a little bit of Spanish, because they speak their dialects in their home countries. We also have youth, although they have similar ages, they also have very different levels of education. We have youth who, in their home countries, they went up to 6th grade and then they have to stop going to school because they had to work. And then when they move here because of their age, they are put in the 9th grade and they have that big gap of education. And so a lot of them struggle because of that. Same with the families. The families have a lot of commonalities, but we see a lot of different family structures. We see extended family who take over the role of parents and become the legal guardians of all these minors that are coming. Brothers and sisters who are young people themselves, they take over the role of parents. And even community members. We've had cases where we had a youth who was homeless, and a pastor in the church said he would step in and become his legal guardian. And now this youth is on his way to getting his juvenile visa, and he lives in a really healthy and happy home. So these are the kinds of things, or the kind of people that we interact with as we implement Adelante. And now I'm going to go into what we do. As we've been talking, this is a multi-level intervention, and based on that framework, we provide curriculum-based programs and activities for both youth and parents, and we also do a lot of community engagement. Delmi is also going to talk about the case management piece, because we also do service at the individual level. I'm going to talk about the first three. Okay, so regarding curriculum-based programs, these are typically 8 to 10-week programs, and they focus on building on the 4 key youth development constructs: competence, confidence, connection, and contribution. And the model that we use is have participatory sessions about prevention topics. You know, we have violence, substance abuse, sexual health, and many other topics around those topics. And we always combine those activities with fun stuff. We go out, we do field trips, and we do really engaging stuff with the youth. Our planning process involves selecting carefully evidence-based curriculum. And in doing that, we are mindful of our participants' realities, and we usually do work to adapt the curriculums that we find with these realities. And we also work on careful documentation of all of our sessions. We have pre-post forms. We have process forms where we record all the PYD constructs that we're addressing on each session. And this is actually where our partnership with Avance Center is really valuable. We in the field are learning a lot about their research expertise and how to really evaluate all these programs. And at the same time, we feel like we can also share a little bit about our experience in the field working with Latino youth and families. So it's a really win-win relationship that we have. And now, Now I'm going to talk a little bit about examples of the programs that we have and how we have adapted those to our youth and families, their needs. We have our sexual health program, which is based on a Cuídate curriculum. This is a STI prevention curriculum that is addressed to Latino adolescents, and it incorporates Latino topics or aspects such as gender roles and family, and we also talk about how our cultural values shape the sexual risk behaviors or not. And as we implemented this program, we realized that there's a really pressing need to develop more culturally competent curriculum, especially now that we have all this influx of newly arrived youth, and we have that, families getting reacquainted. I mean, it's really hard to, like Sean said, it's really hard to communicate on, regular topics, but, imagine talking about STIs or sexual health. And so as we found that need, we started to develop a peer promotion program called SHAPE, Sexual Health Advocates, Promoters, and Educators. They're right there. That's our first group, and this program taught youth not only sexual health content, but also leadership skills and communication skills. And the idea is that these youth will teach their peers and their community about sexual health. And Tatiana, our colleague, who she's not here today because today is actually our first day of the program, and we'll have a few of these youth co-facilitate the curriculum to their younger peers. So we're excited because we're starting today. Then we have other programs. We have our substance abuse, which is based on a storytelling curriculum, and this one focuses on youth who experiment with substances. And through the storytelling, they identify when experimenting with substances turns into abuse. And they also learn coping skills and negotiation skills through stories that are familiar to them. We have also our academic support programs, which is we have a tutoring program in partnership with Puentes, who is a GW-based organization. This is one of our most popular programs, actually. Our youth come every Saturday, and they get help with homework from the volunteers. And we also have Reaching Excellence, who is college preparation programs. And I really like this program because it brings Latinos, professionals from around Langley Park that they themselves maybe have been the first person in their family who graduated. And so they come and talk to the youth about what career path they pursued. And the idea is to have the youth think beyond the traditional occupations that they have, that they have seen in their lives, and just know that they can achieve more by looking at all these role models. Then we have Victor and Erica, which is our branding, the branding component of Adelante. And we talked a little bit about that during the lunch session. But Victor and Erica is a web novela which portrays stories of youth in Langley Park. And you can go on YouTube and watch it. It's 6 episodes. And the process for this has been engage youth in the development of the script and the performance, and acting it and promoting it. And we have applied this same model to other media campaigns that we're doing. We had a really cool job readiness program that targeted parents. And this was really a good example of a lot of adaptation that we had to do with this curriculum. And it's mainly because we are dealing with a very non-traditional workforce, and parents that don't have access to internet or don't have computer literacy, so they cannot go online and job search. So for example, what we did is instead of talking a lot about online job search, we focus a lot on communication skills and how do you walk into a store and inquire about a job. And we did a lot of that, and we also shared a lot of information between each other. We have a multi-family dinners program. Those who were at lunch, we talked a little bit about that. This is a program that we involves the whole family. We have 8 or 9 families who come for 10 weeks, and we provide them with tools to have better communication. And this is all done through a traditional, like sharing a dinner, traditional meals. And the way we have adapted this curriculum is because we have seen so much newcoming youth and families dealing with reunification. We have adapted the activities to address reunification, people getting reacquainted. How do you manage, how do you establish routines now that you're getting to know each other? And we also have Parents as Leaders program, which equips parents with interpersonal skills, leadership skills, and we have focused on sharing knowledge about the school system so they can become advocates for themselves and their children in the school system, which can be really overwhelming. I don't even understand it sometimes. I cannot imagine someone who doesn't speak the language. And then we also have our drop-in activities, and these are just one-time workshops that we offer as we learn of topics that are of interest for the families, and we give this to youth and parents. So, as we hear things that are happening, for example, we're learning that there's a little more, we're seeing an increase in gang violence, so we try to talk a little about that with the parents, sort of educate them about how to be more engaged in the lives of their children, leadership, financial literacy, etc. We also, this is my favorite part, because we have sports and recreation. Oh, he didn't come. Ronald was going to come. Ronald is our soccer coach.
No, you are too.
Well, I was in charge of the soccer program, and this was really an exciting experience. It was initially conceived as a summer program. We just wanted to, do a lot of more sports, and we just started training every week, and it just really became a space where youth just feel connected to their identity. You know how soccer is in our blood, right? So just coming to play soccer for a newly arrived youth who doesn't know anyone is just a way to preserve their identity. And for some of them, it's even a way to connect with friends that maybe they see in school but they don't talk to, but during the program they do, or even to cope with trauma and assimilation. And it's also a very good gateway to engage them in all the other programs that we have going on that maybe they wouldn't normally come, but if they see that the other youth come, then they start coming. So we're really excited about that program. And of course, we have all the fun stuff that youth like. We go on field trips, we dance, we do art. And the last piece is the community-wide activities that we do. And I would like to highlight our most recent effort. It's called Professional Pathways. And this is an effort that consists in establishing connections with different community partners, and the idea is to create avenues for youth in Langley Park to get opportunities to do volunteer work or internships, and hopefully that will develop into work. And the ultimate idea is to create a sustainable network where the community organizations can tap into that human resource, but also youth know where to go if they want to develop professionally. And we also do, I'm going to conclude my session talking about community events that we do. We organize different events. I heard earlier that we were talking about behavioral health and mental health. We try to organize events that are of topics that are of relevance to our community. And we have noticed and identified that there is much need for mental health services. And so this last spring, we held an event to bring light to the issue of mental health and how lack of services is affecting our community. So I'm going to leave it at that, and I'm going to let Delmi talk more about our case management piece. What did I do?
Thank you. Good afternoon. I'm going to stand because I'm short and also because I'm falling asleep. No, just kidding. I I think we have given you a lot of information, and I wanted to see if any of you will be able to tell me the 4 PYDs that we use with Adelante. In Spanish. No, just kidding. So I am Delmi Alballero, and I have worked with the Latin American Youth Center for the past 10 years, since we started the Safer Latinos initiative with GW. I started as an outreach worker with that initiative, moved on to case management, and then and to lead workforce development with our Prince George's offices. The case management that we offer in Adelante, they really merge very well because the Adelante program uses the positive youth development model, which is our vision and mission of LAYC is to provide caring and mentoring support services as much as we can in terms of wraparound services. So it goes, with our salsa, as we say in LAYC, which is really support the youth for transition into adulthood successfully. And our focus with Adelante is with the academic support, but also in basic needs. What we see in our community in Langley Park is really, really basic needs. My children don't have the vaccinations that they need to start school, or even, some get suspended because they don't have that. So our case managers, we have 5, but in reality it's like 6 because Angela, even, despite she runs with the community prevention intervention programs, but she also steps into the role of case management because the need is it's high demand for a lot of basic needs. And we are troubleshooting in terms of many situations that we encounter. Uniforms, basic, needs like food, shelter, housing. It's a reality that we see. So in providing case management to 240 youth and their parents and their families throughout the duration of the project, at some point our case managers have a caseload of 25, 30 youth. Luckily, Sean's going to explain a little bit later on how the issue of capacity was addressed in terms of cutting the amount of youth that we have enrolled at one point in time. So for example, from now until January, we have 120 families enrolled in case management, but in January, we will drop 60, so our case managers will have a smaller caseload. But from now until January, they are doing case management, and they are also in the dual role of developing and implementing program activities, the ones that Angela explained, base curriculum activities and also drop-in sessions. So that's, the dual role, the case manager's experience and the capacity-wise in terms of implementing Adelante. For us, it has stretched our capacity and it has developed us professionally to the maximum capacity. I have learned so much, and I'm sure my colleagues are learning so much in terms of developing and implementing Adelante. It's been a very fascinating experience. The challenges that we face also, presses our heart many times because we see the many needs and we see the limitations as well. So the next slides are going to highlight some of the challenges and some of the things that we have done, to best address these challenges. Okay, so we have many of our families are recently arrived. Many of our youth are new arrivals, and that brings the need for them to get to know the legal system, the school system, the health system. So many systems that our families need to get familiar with, and that's where our case managers come in terms of supporting all of our youth and their families in terms of navigating all these systems. So we connect to other clinics, to other resources, so that the families get to know and get to go to all these places so that they can get all the support that they need. At some points, Ricardo, I don't see him here, but he comes in and says like, Jefa, I'm gonna say, that means boss, say, we see that our families need legal services, and so the counselor at High Point is putting together a legal seminar. Can we invite all of our families and our youth? Sure, so all the case managers get on the phone and start calling all the parents that we have so that they can take advantage of this legal clinic that is coming. we wanted the intervention is to talk about three main topics: the sexual health, the substance abuse, and the violence reduction. If we tell parents and youth, come and hear about sexual health or violence reduction, they won't come that easily, But if we pair it with, we have information about legal resources, or we have information, we have a distribution of bags of food, they'll come, because that speaks to their needs. So pairing these activities to what their need of the families are at that moment. So that has been, the other thing is the lack of trust. Sometimes, we have been in Langley Park 10 years, but that doesn't mean that the new families know us. So we ask, Madrecita, will you bring, we talk to the parents, would you bring your friend? Or we talk to the youth and we ask them, could you refer to our youth? And that has been the most effective referral source for us. Having our parents vouch for us, having our youth vouch for us, and really, bringing us more families and youth. So this is Ricardo, the one who comes into my office and says, Jefa, we have this resource, and we have this. And of course, like Marilyn, Karina, Connie, we have America too, and Tatiana. They are a wonderful team. We are very lucky to have Emily with us, who started working earlier with Adelante, and it has been, developing all these resources and opportunities for our families. So that's one of the challenges. The other is adapting to a new culture. I throw Spanish words to you, in an effort to see how it feels, like what it is to be in another country and not know the language. I mean, it's very minimal. But when we come to this country, we have to learn so many things. From where do I enroll my kid? In my country, in my town, we just go to the local school that is in our canton, in our little village. And that's where we enroll our kids. Here, you have to go to another office, and that office will send you to another, so where do they go? That's our case manager help our parents navigate that. Also, we implement, as Angela explained, the Parents as Leaders program, which helps parents develop advocacy skills, leadership skills, so that they can, they are, the advocates of their children. So that's a way that we find to, build the skills of leadership for our parents. As I mentioned before, the economic issues that we see in our community are, very, very hard. So our youth have the pressure to work. They need to come back from school and go to work in the evenings, or they work in the weekends. So a lot of the things, like that we see in other youth, maybe youth in Bethesda is worrying about what kind of soccer shoes they're going to wear or what sports they're going to do. Our youth are worrying how am I going to go to work and study and be really effective at, passing from 8th to 9th grade, from 9 to 10. Because many of the families have, the need for them to contribute for rent or for food. So it's, we have, our case managers do their best at convincing the parents that there is a need. Immigration may not allow your child to miss school, and we enter into that dialogue. This is a reality, while in our countries, your child can start working and helping you attend here, the legal system, wouldn't allow that. So it's, our case managers enter into that role of culture broker and explaining the different realities of this country as well. Also, we explore different resources. Telemental health is going to be one of the things that we'll be able to offer through Clínica del Pueblo, which is a very good partnership. We have resources within house because Adelante is part of Maryland Multicultural Youth Centers, and we provide housing support services, workforce development, GED classes, and other intense case management services through our Promotor Pathways program as well. So we connect our youth to as many resources as we can. The other issue that we see in our community is the lack of safety and the violence in our streets. Youth are afraid to come to our programs if we do them in the evening, because then later in the evening they feel unsafe to go back home. So what we do is provide transportation back and forth You know, they can come when it's clear, when it's sunny, they come to our programs. But then our case managers, Angela has been driving around 12 at midnight, the youth from the soccer program, you know, and that has been the case for many of our case managers, around 10 o'clock in the evening, driving our youth to their homes. We see, and this we mentioned earlier and also in our lunch session, when the youth don't feel and don't get the support that they need in terms of finances and emotional support, they are lured by gangs. So, you know, a lot of our program and activities serve that purpose of the social outlet that is safe for the youth to interact and get to know each other. Really, the big one we face is the crowd housing. We have, as you can see, 2.5 people living in one bedroom. And that's a reality that brings, you know, many issues, because if you are on top of each other, you know, you're not going to be very polite to each other. And so many of our youth have come recently, so they find their parent already married, they have more children. The youth resent their parents because they feel left behind. The parents resent the youth because they are really, you know, like, you don't really value what I do for you. And then the crowding housing, it becomes a very difficult situation to manage at home. In some instances, we have removed the youth from the home for 21 days to give space for these issues to be worked out. And then, you know, hopefully the youth can return to a safer environment when some of the issues are addressed. The other issue that we face is that, as I mentioned before, knowing and managing the different systems, understanding how to enroll the youth. Many of our case managers come and say, like, you know, this parent needs money to get to the consulate and get her passport, because the passport is needed for her to enroll her child. So jumping all these barriers so that the youth can get enrolled is the role of the case management in our program. Language barriers, you know, youth, our case manager help parents fill out forms. Also, other parents who already know how to do it, they help our other parents. And that's where, you know, the social networks that they build through our programs, and they get to know each other, they get to support each other as well. The issue that we have young people being the legal guardians of other young people. That's a reality that we have in our community. And even it's a barrier for enrolling them in our case management, because you know, they are minors taking care of minors, and they are minors working full-time, and they cannot make it to enroll the youth and into the case management that we can offer. So we have, you know, we have ways to probably make sure that young people who are in charge of other young people, you know, they get support of the case managers. They enter into that supportive role even more, because it's so much needed at that point. We really provide, I remember Marilyn sharing with us one moment when she said, like, I practice with the youth who is 19, taking care of another 15-year-old, how we, you know, how he can go to a teacher's conference meeting and talk and ask questions. And the youth was very attentive and practicing with her on how to, you know, interact with the teachers of his brother, younger brother, as well. So that's, you know, very important. The other issue that we have is compounded trauma. Our youth who have recently arrived or who came a year ago, when we had that surge of youth leaving violent countries, they have already experienced violence in their home country, with the gang issue, with domestic violence, and with any other issues. When they are on their way here, they face a lot of issues of, you know, kidnapping, rape, and a lot of other witnessing violence. When they get here, the gang violence issues that they have in the community, and also, you know, the crowded housing, the difficult issues living at home in that community. So, as we mentioned, the need for in-house counseling, substance abuse, and, you know, we're still seeking more resources to provide support for our youth, because that, you know, that mental health, as Angela mentioned, is really needed in our community. And lastly, the family reunification issue, we cannot say enough about this. There is a great need for us to break down that, like if you left your child when he was 1 year old and you brought him when he's 15, you don't know each other. You just don't know each other. And you cannot, as a parent, you cannot assert your parenting role, and the youth is feeling like resenting the parent because, you left me there, and I don't know you. How dare you tell me, that I cannot go outside and play with my friends? You are not my father. My mother or whoever is my, significant role parent is back in my country. It's my grandma, it's my uncle, it's whoever the child was left with. So family dinners and one-on-one sessions, family sessions, address this reality that we see in our youth. So that's a little bit, snippets of what we see in terms of case management. I could spend a whole week or more talking about it, but I'm really, really inspired and grateful for the case management team who give their very best every day, and they're very creative in coming out with resourceful. We enroll, I think we were at 30 of enrolling the 60 new youth that we are enrolling for this fall. And they said, well, because we are enrolling, we are developing the programs, we haven't met with our youth yet, let's do a trip to the zoo. And that will address the competency of, connecting youth to knowing, their cultural competence. So, and they will get to build a relationship with the case managers. So there they go, putting 20 youth in the van and the metro, teaching them how to use the metro, and going to see, our little cousins, the animals, who are part of our family too. And so, but they, get to connect and be with the youth that day. And they do it when school is closed, so that, there is no barrier in terms of we're not taking them out of school, but we are using that day so that they are not at home probably doing who knows what, hopefully positive things, but we make sure that they are, in a safe environment as well. So I really, really appreciate our case managers and the team. Oh. I forgot.
So I'm going to finish our discussion this afternoon just giving 3 examples of how we've adapted the Adelante intervention research goals to ensure success in the Langley Park community. The first one that came up was an issue of capacity that Delmy has alluded to already with respect to case management. When we started recruiting families into the cohort, we had a risk screening tool, and the idea was we would assess and try to recruit the youth that are at highest risk. And what we learned is that families were dealing with multiple issues, from housing instability, issues related to legal status, unemployment, and communication. And the level of need for all families that were being enrolled far exceeded the expectation for our case managers. This isn't a referendum on our case managers, and I think at this point I'd like to, again, on behalf of the Avance Center, ask them to stand and formally thank you for all the hard work you do for the members of the Langley Park community as well as for the project. They're standing in the back there. So we realized early on we had to do something to address the capacity issue and to really minimize the potential for burnout of our case managers, because they, as you have already heard, give 24/7 to this job. So we restructured our cohort sampling and planned a staggered enrollment to reduce the sample size, which also is reducing our follow-up period, and also that we can limit enrollment to, so that and it sounds like a lot, but divided among 5 or 6, it is a lot still, and I understand that. But a limit so that at any point in time, there weren't more than 120 families enrolled in the study, because that was the maximum that we could deal with. The second issue I wanted to bring up was an issue of intervention coverage, or where the intervention would be delivered. So the goal was to provide activities throughout the entire Langley Park community. And so I'm going to throw up the map again, a little larger here so you can see it. Because we didn't want transportation to be a limiting factor in who participated in our intervention. Okay? So public transportation is limited in Langley Park to the major routes. So if you're familiar with the area, it's up and down Riggs Road, across University Avenue, up and down New Hampshire Avenue, and Carroll. But it is limited. And the high school, High Point High School, where a lot of the kids from Langley Park attend, is 5 miles away. It's not in the community. Okay? So MMYC is located in the star on the far right there, which is the lower, the southwest part of Langley Park, has served for the center of our operations, where surveys are completed, case managers meet with families that are enrolled in the project. And a lot of the Adelante activities that Angela discussed are held at MMYC, but it's not accessible to all. The high school, High Point High School, is a viable alternative, but as you can see, it doesn't even fit on our small map here. It's quite a ways away. But at the high school, we're competing with other projects, other research projects that are going at the school, school activities, after-school activities, and sports programs, and also limited by when late buses are available. So there's only 2 days a week where youth in the school can take a late bus, which provides them with a means to get home after the activity. So we're very lucky at some point to engage with Equity Management, which is a management team, a group that manages 3 of the apartment complexes in Langley Park. And they donated a building, or allow us access to a building, which is up here on the left. We call La Casita, which you can see that we've also put up a sign that has Adelante name on it. And this is located closer to, this is located in the blue area up there, more of the northwest corner of Langley Park, okay? And so we use the space for Adelante activities. We hold project and community advisory board meetings there. And we also constructed a computer lab there, as you see the picture on the right. And we have various workshops held there, as is being going on here, a health literacy program conducted by Karen Pomerantz, one of the members of the Adelante team.
He put the desk together.
This is my contribution. And then we are also very grateful to have other community organizations and the schools, Casa de Maryland, Langley Park Community Center, and Langley Park McCormick Elementary School, which are indicated by the 3 stars in the middle of the Langley Park community, that donate space for us to conduct our Adelante activities. And this enables us to reach a larger portion of the Langley Park community. Finally, and this has been touched on already, just wanted to bring up the issue of balancing our research goals with the greatest needs identified by the community. So the outcomes that we're focusing on, the healthy sexual behavior, violence, and substance use prevention, really were born out of previous research that we conducted in Langley Park, the Safer Latinos projects. We are following a community-based participatory research methodology here, and so focus groups and key informant interviews have been conducted by our staff or by other organizations that are working in Langley Park to elicit from community members the greatest needs. And we're trying to adapt, as has been alluded to by both Delmy and Angela, adapt the Adelante intervention activities to the extent possible to integrate these issues into the different activities. So as has been mentioned already, reunification for youth is one of our major challenges. And so we've integrated discussions about reunification into and parent-child communication, because that comes up, into the workshops for parents. More recently, Langley Park Youth have participated in focus groups this past summer, identifying bullying, specifically cyberbullying, as a major issue that they would like us to address. And so we're currently integrating discussions of cyberbullying into the family dinners so that parents are aware of it and know how to recognize signs if their child is being bullied. And then we're also identifying evidence-based curriculum that's focusing on bullying for youth that should be implemented this fall. And then a primary need, again, that was mentioned already by Delmy, that we repeatedly hear from youth, from young adults, and from parents is the need for more work opportunities. And so, as you know, because this is a federal grant, we're limited in how much we can actually involve. Langley Park residents in LAYC has been running largely. Karina, and I thank you for this, a very successful, and I don't know if you know how successful it is because you haven't seen the data, but a very successful job readiness preparedness activity for the youth. And it's showing great success. And then as Angela had mentioned already, MMYC partnered with an arts education project that in Maryland that offered jewelry making classes, as well as small business training, so that the women that were learning how to make the jewelry could take it upon themselves to continue and make some money off of it. So these were just 3 examples that represent some of the challenges and the solutions that we've collectively implemented to adapt our research goals to the needs of the Latino community in Langley Park. Some lessons: flexibility enhances success, and these activities must be community-driven, culturally appropriate, and practical to ensure that what we're implementing in terms of our prevention activities are ethical, acceptable, and above all respectful to enhance youth development and well-being for the residents of Langley Park community. So thank you for your time, and I think we have 10 or 15 minutes for questions if you have any. And I'll ask you, if you do ask a question, could you just identify who you are? So it's a great question. We're working on that. How's that as an answer? Yeah, the question was, is the collaboration with GW guaranteed for the future? We have been working in Langley Park with Maryland Multicultural Youth Center for the past decade. The funding has not always been consistent, and we are doing our best to continue it. As you know, how funding goes. So we are trying and looking at many different resources. And we're not alone, and that's the nice thing. There are other community-based organizations that have been working in the same, and so we're trying to work together and leverage whatever support the other organizations have as well. So, yeah. Yeah, go ahead.
We do see. Oh, he's asking about parent engagement in our different programs. If what we typically see, whether it's more mothers than fathers, or what's the makeup or the. We do see my personal experience, for example, with the job readiness program. We had all women. Our family dinners program didn't have just one father in our spring sessions, but this cohort that's coming in the fall has a lot of men, and we're really excited to see that because a lot of them just have to work really weird schedules. Sometimes they do want to come, but they just have to. Sometimes they have gone days without working, and then an opportunity to work comes up, and they have to go. I have to say, in the programs that I have implemented, I do see. I don't have data to, it's just what I've observed. I do see more mothers than fathers, but I know in the past we also had a lot of men engaged in our Parents as Leaders programs as well. that is a good point. We've had actually cases where the youth really wanted to come and enroll, but the father didn't want to come, or the mother didn't want to come. So yes, that is specifically for case management, because our programming welcomes not just youth that go through case management, but any youth in the community, which doesn't require that the parent comes as well. Of course, we have to have consent by the parent, right? If the parent is really adamant about the youth participating, then yes. But that, we have seen some cases that, yes, that has been an issue. But a lot of our parents like to be engaged, and they are okay. They see the need. And I would say I've worked with Adelante for about a year, and I've seen with this, we have done 3 cohorts. We're in our 3rd cohort now. I think I have seen a lot of interest from parents, because we see a lot of newly arrived. In this group, I'm seeing a lot more than the previous 2. And parents know that they need help. And so we see a lot of more interest from the parents. I don't know if you've been longer in the project. I don't know if you.
Well, I would say that one of the things that we see, we enroll youth who are, for case management, we enroll youth who are Latinos living in Langley Park and going to 8th and 9th grade. Those are the 3 requirements for them to enroll in case management. But for programming, they can participate, youth from the community can participate. So all the youth that can participate and that we can, provide the prevention topics, they can do that. And the soccer too. So I don't know if that answers your question, but it's wide. It has 2 circles. One, the case management that has those 3 requirements, and then the wider circle of the youth in the community.
Was it a formal tool or no? Yeah, was it formal or no? So we, early on, discontinued using the risk screening tool. It wasn't formal. It was something that we developed for this project in particular, just because everyone was scoring at a level, coming in with multiple issues, that it wasn't really differentiating. We weren't finding low risk that we were going to. Right. Yes, we are addressing the trauma and mental health through applying for grants. The issue continues to be the availability or lack thereof of services in the community. So we are trying to partner with La Clinica, that is in DC, but that's 6 miles away from downtown Langley Park, and not, as you know the area, not very easy to get a family from downtown Langley Park to go to La Clinica for services, and that's where the services, and they have a wonderful program, La Familia, that they do trauma, specific for trauma intervention. But they are in the process of opening a center in Riverdale, which is closer, still not in Langley Park. It'd be nice if we could have something in Langley Park. So we are approaching this on 2 fronts. One is specifically for the trauma and providing a trauma intervention for youth, and we're waiting, that's been submitted and waiting to hear from funding of that. And then we are currently planning on developing something more related to mental health. The challenge there is, again, where the services would be provided, and if we could supplement services that are currently being provided in the schools to help there. Okay, but it's continually been an issue of lack of availability of services in the community, and I hate to say this, but the lack of certified bilingual therapists. So Prince George's County did open an office, Department of Social Services, across the street from our offices in Langley Park. And for the entire county, there are 2 substance use counselors who are bilingual. And luckily, they were both in that office. But you can imagine the caseload. Yeah. So, and as Delmy mentioned too, I know with La Clinica, we're also exploring telemedicine, telepsychiatry, so telemental health. So we're exploring different options that will work in the community. So. Any other questions? Thank you again for coming this afternoon.